Health Matters. We're joined today by Dr. Mark Komrad. Dr. Komrad is a psychiatrist on the clinical teaching staff of Sheppard Pratt Hospital and Johns Hopkins Hospital. He also is a board member of the Maryland Foundation for Psychiatry. Now, before the break, Dr. Komrad, we were talking about how psychiatrists are often depicted in the media. But one of the other things I think is important to mention before we get back on that topic is to talk a little bit about the Maryland Foundation for Psychiatry, who they are and what they do.
The Maryland Foundation for Psychiatry really does exactly what we're doing here today.
Okay.
It's a nonprofit organization that tries to explain who psychiatrists are, what we do, what are the state-of-the-art treatments for mental disorders, and to try and help people see that mental disorders are really not that much different from any other medical disorder, and therefore we shouldn't necessarily as a society have special negative attitudes, the very kind of attitudes that we said, Hollywood helps to promote, and that creates what we call stigma, which are prejudice against people with mental illness, interestingly, and those who treat them. And one of our missions is to combat stigma in the act of educating the public about a correct understanding of both mental illness and its treatments.
Well, before we get further into that, one of the things that especially concerns me about stigma is one of the things that is a barrier to people receiving the proper care for their mental illness.
Absolutely critical, because when we say we combat stigma, that's not just in order to make people who are already in treatment comfortable. You're quite right in saying that the most important thing about combating stigma is to help people overcome their embarrassment to get help, because it is often stigma that causes people to be reluctant to seek help, afraid of what other people are going to think of them, by virtue of being in mental health treatment, which is in many ways, a catch-22. It causes them to avoid the very thing they need because of their own prejudices. So that is something that the Maryland Foundation for Psychiatry is very, very devoted to trying to lift.
Well, the other thing about stigma is to the degree and extent that people don't seek treatment because of misinformation, it really compounds their suffering.
Right, that illnesses get worse. Problems that can be interrupted or reversed progress. And then what happens is you have twofold problem. One is the actual condition that you're suffering from and the embarrassment of that. It gives meaning to that old phrase, adding insult to injury.
Okay. Well, let's get back to some of the ways in which psychiatrists are portrayed in the media and really not represented accurately.
Well, we talked before about the monstrous depictions, such as Silence of the Lambs. Then there's a whole other set of depictions, which are the psychiatrists as clowns or buffoons or as idiots. I'm thinking of a movie like What About Bob, where Richard Dreyfuss plays a psychiatrist that is increasingly made fun of by his patient Bill Murray, and at the end of the film, as many of these kinds of depictions, the psychiatrist is the one who ends up in the hospital. While the patient ends up, being the so-called healthy one. And as you and I were talking earlier, it's interesting that psychiatrists seem to be the only kind of physicians who become distorted in this way by the media. Why should we care? Not because I, as a psychiatrist, am insulted, but precisely because of the issue of stigma. The stigma is not just about mental illness, but it's also about the people who treat it. So if you think that you're going to get treatment from either a monster or an idiot, how much more reluctant are you to show up? People don't come armed with those prejudices about, say, a cardiologist from the media like they might from a psychiatrist. We're just these guys. We're just these docs. And, you know, we are on the patient side. We're trying to do the right thing. We're very well trained. We have incredibly effective treatment at our disposal. What a lot of people don't realize, for example, the statistics of treating psychiatric disorders. Do you know that we are better at treating mental illness than other doctors are at preventing strokes or heart attacks? That we're better at reversing the course of serious psychological suffering than the statistics are for reversing the course of cancer. And yet, if you have a cancer, you've got about 90% chance of showing up for treatment for it. If you have a mental illness, you only have about a 10% chance of showing up for treatment for it, often because of stigma. Often because of people waiting way to the last minute.
Well, it's also interesting because according to the National Alliance for the Mentally Ill, 1 in 5 families are going to be affected by a mental illness.
Right.
So we're not talking about, you know, a handful of people. We're really talking about illnesses and problems that affect a number of Americans across all socioeconomic lines, all racial and ethnic and cultural lines. So this is something that's extremely important to educate people about.
Right. And also, one of the things that I would say, everybody is always so interested in preventative medicine, you know, preventing problems. It turns out that psychiatry probably has the most effective ability to prevent either problems from beginning or from problems from getting worse. If you can make early interventions, particularly for children and adolescents or young adults, the sooner you can get in there and make an intervention, you can change the entire course of a person's life. We are very, very effective preventative medicine docs.
That's really fascinating, and I'm sitting here thinking about all of the ways in which our language in this country, I was thinking about the Wayne's World movie when one of the characters said to a woman, "Are you mental?" You know, we call people crazy. There's the whole thing about being retarded, all of the ways in which stigma is associated with mental illnesses, and we don't see them like cancer, like, you know, coronary artery problems, like a lot of the other diseases that people are not at all reluctant to seek help for.
Well, you know, the way I've come to understand this over the years, why are we more vulnerable to this? It's because mental life is the most dear and precious thing to human beings. It is one of the things that most make us human. Tell you the truth, it's one of the reasons I became a psychiatrist, is because of all the areas of medicine. I was interested in that area that involves the core essence of what it means to be a human being. And for that reason, when something goes wrong in that area, it can be among the most frightening things to happen. And I think that the fear that's associated with that largely accounts for some of our complex and mixed feelings about mental disorders.
That makes a lot of sense. The other thing that also strikes me is that there are a number of kind of competing interests, because when you think about religion and spirituality, especially in certain communities, that's one of the ways in which people try to resolve whatever their mental and emotional issues are. You know, being African American, I recognize that often people, that's one of the reasons that the African American community is so much involved in spirituality and the faith community. And at times I see people struggling with those two things. Well, if I pray about it, it'll be okay.
Yes.
And I'm well known for saying, well, you know, you can pray about it, but also go get some help as well.
Right, right. You know, all throughout history, we've evolved all of these institutions to take care of us as human beings, our essential humanity. And I like to think all of those institutions, you know, are working together to make a comprehensive whole. We psychiatrists very often partner with spiritual and religious leaders who understand that we all have a piece of the truth, and they can refer to us for our expertise, and it's not unusual for us to recommend to our patients that they also should get some spiritual consultation or spiritual dimension to their lives, sometimes even going to consult their spiritual director as part of their healing process. Because we all are working hand in hand. We all together make up the whole perspective on what it means to be a human being.
Well, in the couple of minutes that we have left, let's talk a little bit more specifically about what the Maryland Foundation for Psychiatry does in terms of trying to educate the public about psychiatry.
Well, we have a wonderful website, which is Psych Foundation. mdpsychfoundation.org, which has a number of really interesting articles about psychiatry, about movies that depict psychiatry or mental illness, about articles that appear in the news. So that's one way that we serve the public. Another way is we sponsor programs in which we bring in often people who are musicians or artists. Sometimes we give lectures in conjunction with a movie that's just released or a play down at the Hippodrome. We also give awards to various organizations that are helping the public understand or give treatment to people with mental illness. And we have a variety of awards that we give out. We're a nonprofit organization, and we are here to empower both people who are suffering and to empower those professionals and organizations who are helping them. Some of whom are psychiatrists, but many of whom, like the Baltimore Crisis Response Center, are organizations much broader than psychiatrists that are. We're all serving the same cause, and we're a clearinghouse that brings together information and empowerment for all of those that are pulling together for the mentally ill.
Well, Dr. Komrad, I want to thank you for the important work that you do. Thank you for coming in today. There's lots that needs to be done to give people the correct and proper and accurate information about psychiatrists, psychiatry, and mental illnesses. So thank you.
Thank you.
And I want to thank you, viewing audience. And remember, if you or someone that you know needs help with a mental health crisis, you can call Baltimore Crisis Response 24 hours a day at 410-752-2272. And remember, your mental health matters to us. Thank you.